This is the Mikedjkelly podcast.
Mikedjkelly.
The aim of this podcast is to help those with type 2 diabetes and to prevent those without it getting it. Type 2 diabetes can be a pretty life-changing illness if not controlled, but life can be okay if you control it. What is type 2 diabetes? According to Wikipedia, diabetes mellitus type 2 is a long-term metabolic disorder that is characterized by high blood sugar, insulin resistance, and relative lack of insulin. Common symptoms include increased thirst, frequent urination, and unexplained weight loss. Symptoms may also include hunger, feeling tired, and sores that do not heal. Remember, I'm not a doctor or medically qualified in any way, but if you want to get in touch about this podcast, please contact by email hello@mikedjkelly.co.uk or on Twitter at @BeNiceToOthers. That's spelt B, the letter B, the word nice, the number 2, and then the word others. And don't forget, in case you missed my tweets about new versions of the podcast being available, you can always get them by going to iTunes and searching Mikedjkelly.
This is the Type 2 Diabetes Help Podcast.
I have had type 2 diabetes for over 20 years and put my reasons for getting it down to a bad diet, little exercise, and a job which involved a lot of driving. I would leave home, get into a car, go to an office, get out of the car, no walking or exercise, and plenty of snacks while driving. There are many aspects of the illness that can be upsetting: getting told you need to inject yourself twice a day, getting foot sores, worries that you might have to have injections into your eyes. One thing I will say is that here in the UK you get a lot of help and support from the NHS, but it's not perfect.
Are you coping with your type 2 diabetes?
So let's start at the start. If you have an increased thirst, and you will know if you have because it's a very noticeable thirst, if at the same time you're going to the toilet to urinate a lot more often, so much so that you're aware of it being annoying, you should go to your doctors and get it checked out. They will prick a finger and put some blood on a sensor and give you your blood sugar score. It should be around 5. If it's a lot higher, it's likely you will have diabetes. If you have just been diagnosed as having diabetes, you can reverse it in some cases in the early stages by going on a strict diet, which forces your body to start producing insulin again. Good diet is important to anybody with diabetes. A day in my life goes like this: 6 a.m, blood test. Anything between 5 and 7 is okay. If it's higher than 7, I have an injection of Nova Rapid. The amount depends on how much higher than 5 my sugar count is. If it's lower than 5, you need to eat something to get your levels above 5. It is a difficult balancing act. Unless my sugars are below 5, I do not normally have any food in the morning. I walk the dog for about a mile for my benefit and his. After the walk, I lift some weights 25 times and then touch my toes 25 times. 11 a.m, check blood sugars. If around 5, I will have something to eat like a can of soup or bacon and eggs, etc. 2 or 3 p.m, again, lift some weights 25 times, then touch my toes 25 times, unless I'm going for a walk or doing something else that is physical. 4 p.m, check blood sugars. If around 5, I will be okay until the evening meal around 6 o'clock. Most days of the week, my evening meal will be meat or fish and veg. I try to avoid potatoes, bread, rice and pasta. Normally it's cabbage or broccoli or ratatouille with steak or chicken. This means I do not need a lot of short-term insulin as I used to use in the past. I currently take around 6 p.m, 9 Nova Rapid and 35 of the slow-release Lantus insulin. 10 or 11 p.m, I check my blood sugars again. If around 10, I should be okay during the night. If lower than 10, I might have something to eat depending on how much lower they are. So we're aiming for a blood count of around 5. If you go lower, you can have a hypo. In my case, this means getting sweaty. My vision becomes very greeny and white, which is one of my warning signs. If you are having a hypo, you need to have some fruit juice, biscuits, etc. to get your sugar levels up. If your blood sugars are always high, you are not controlling it and it will lead to long-term damage. Remember, I'm not a doctor or medical expert, I'm just telling it as it is. If you are driving, you need to let the DVLA know that you have type 2 diabetes, which can mean you need to renew your driving license every few years. If you are driving, you're supposed to check your blood sugars every 2 hours to make sure you're not having a hypo. I check my blood using a sensor meter and pricking my finger 4 or 5 times a day. It can be annoying. There is another system called Freestyle Libre Sensor, where you have a patch the size of a 10-pence piece attached to your upper arm, and you wave a small scanner or smartphone past it to take your blood sugar readings. This is a much easier way of doing it, but when I last checked it was not available on the NHS, and the patches last about a week and cost £25 a piece. I have used this system as part of a trial before it was released, and it does give you better control over your blood sugar monitoring.
Sensible diet and regular blood checks.
I changed my diet just over a year ago after reading the Mikedjkelly diet book. It's a good book and well worth a read. It gives some examples of how people have reduced their daily insulin dosage by changing their diets. Whilst it does not say you need to give up anything, that's my choice with regards to bread, pasta, rice and potatoes. I just find it works for me. The book also tells you that eating cheese, eggs and full-fat Greek yogurt is good for you. Since giving up potatoes, rice and such, I have lost weight and my Nova rapid consumption is about 50% lower than it was before I changed my diet, and my Lantus insulin is slightly lower. I have more recently also given up eating cakes and custard slices. It's strange, but when you give up bread and sugary things, you find you no longer need to go to the likes of Greggs or McDonald's. I'm currently out of work but starting a new job in the near future. When working, checking your blood sugar levels can be difficult, as you do not want to be sat at your desk in full view of everyone, pricking your finger. Equally, you do not want to be injecting yourself at the desk. Normally, you end up in a toilet cubicle trying to balance all the bits you need without dropping them on the floor. The best I ever had was in one job where they allowed me a pass to the disabled toilet, which had more room and facilities. When I had the Freestyle Libre Sensor patch, this was never an issue as I could check my blood sugars at my desk.
This is the Type 2 Diabetes Help Podcast.
For most of my 20 years with type 2 diabetes, I've been seen by the professor at the Manny Cousins Diabetic Clinic at St James's Hospital. However, this has now changed and I'm seen every 6 months by my local doctor. My only complaint would be about eye tests, which used to be done at St James's. These now happen at random, difficult to get to surgeries all over the city, and if you need a more important eye appointment, this is at Seacroft Hospital, which is a nightmare to get to if you don't have someone who can drive you there. I mention these things because if you do not have friends who have type 2 diabetes, you may be wondering how other people cope with the disease.
Are you coping with your type 2 diabetes?
You do need to look after your feet and make sure you are wearing the correct footwear. You need to check your feet on a regular basis, looking at them and feeling them for anything out of the usual. You need to check your shoes before putting them on to make sure there are no bits of grit or fragments in them which can damage your feet. Diabetic foot disorders can make it difficult to get comfy, big enough socks. I use Allure, A-L-E-R, non-elastic, 100% cotton Bigfoot socks, which can be bought for a reasonable price on eBay. Because I suffer from Charcot foot, I have to wear supportive medical shoes to stop me getting ulcers. I have 2 pairs. I have never in my life been so restricted on shoes to wear. They are provided by the hospital and they do work. I've not been back to the Hotfoot Clinic for over 15 months with any foot ulcers. I think in the Leeds area you're only allowed 2 pairs of footwear, but I believe different hospital trusts have different policies. I touched on the Hotfoot Clinic. If you have any sort of foot ulcer and you are diabetic, you are better going to be seen by the local Hotfoot Clinic as they are more skilled with dealing with diabetic ulcers. I have in the past gone to the local GP and the treatment has not worked, and in the end they refer you to the Hotfoot Clinic. I'm not sure if Hotfoot clinics are available in all areas of the UK, but if you are type 2 with a foot ulcer, I would look to see if you have one. The service normally works by you giving them a call, describing the problem, and they will guide you from there. You should also get regular foot checks, not just when an emergency arises. I get 6 monthly checks at the NHS Podiatry Centre. Your GP should be able to advise if you need this. I mentioned about how much insulin I take around 6 p.m. each day, but I did not tell you how I take it. So here goes. I remember when I was first told I would need to inject myself daily, I was petrified at the idea of giving myself an injection. But you get used to it and you'll be amazed how easy it is. The normal advice is to have the injections in the lower part of your stomach or your thighs. I find the stomach easier than dropping my pants. I need 2 injections a day, normally both around 6 p.m. Nova Rapide, which I take 9 of, is to reduce sugars after a meal. Lantus is the slow release insulin and lasts for 24 hours. I take 36 of this. If my blood sugars go high, I take additional Nova Rapide to reduce it. How much is based on how high my blood sugars are. If I got up and they were 12, I would take 6 Nova Rapide. You should not inject in the same area all the time, as this can cause damage. You should rotate. I once went on a course run by the local chemist, and they say you can use any of your stomach area, so why not create an imaginary circle around your stomach button and work in that area. Remember, I'm not a doctor or medically qualified in any way, but if you want to get in touch about the podcast, please email hello@mikedjkelly.co.uk or on Twitter @BeNiceToOthers. That's the letter B, the word nice, the number 2 and the word others. And don't forget, in case you miss any of my tweets about new versions of the podcast being available, you can always get them by going to iTunes and searching Mike DJ Kelly. So remember, a bit of exercise, a sensible and not excessive diet, regular blood sugar checks, and look after your feet. That's just a quick overview. I might be back with more Type 2 podcasts in the future. You can find out more info from the NHS Diabetes website and from the Independent Diabetes Trust.
This is the Mike Kelly Podcast.
Mike Kelly.